News 4 at 11 starts now.
And one man's survival after a traumatic brain injury that he suffered while riding a bike in D.C.
Doctors say he's lucky to be alive. A D.C. man hit by a car while riding a bicycle. He couldn't have stopped it, but tonight doctors say there is one thing that could have protected him from some of the worst injuries.
This 30-year-old D.C. man says he has no memory of being hit by a car while riding his bike home last spring. But the scars from his injuries are a stark reminder of the pain he suffered.
It collapsed my left lung. It broke several of my ribs, broke one of my spinal vertebrae, and a number of contusions all throughout my body. But the most significant and difficult part was it also broke several bones in my head, my cranium.
The car hit Robert while he was pedaling along this busy stretch of H Street Northeast. It sped away quickly without stopping, but a witness who saw what happened called 911. Paramedics resuscitated him and took him to MedStar Washington Hospital Center.
So he was comatose. He had had a severe traumatic brain injury, and he was not following commands, not opening his eyes.
Neurosurgeon Dr. Rocco Armonda says Robert's injuries were so severe, they had no idea if he would survive. And while there was no way he could have prevented this injury, one thing could have made it less severe: a helmet.
But certainly a helmet would definitely help in terms of decreasing the impact that his skull made with the ground. You're most vulnerable when you're hit at high speeds without a helmet.
Studies show that bike helmets reduce head injury risk by 85%. Yet of those who died in bike accidents, fewer than 17% were actually wearing helmets.
When Robert was hit, he was riding one of these, a bicycle from Capital Bike Share. It's a popular program that's gotten a whole lot of people in our area to start pedaling. But it's also come under fire because it doesn't offer these bike helmets. And so a lot of people, like Robert, end up riding without them.
But it's not the law in D.C. or the neighboring jurisdictions. So while we do encourage helmet use, we don't require it.
Very important for anyone who's on a bike to wear a helmet. And unfortunately, I learned that the extremely difficult way.
After a few days in the hospital, Robert's health started to improve, but his recovery would be a lengthy struggle. Robert eventually woke from the coma, but had to undergo weeks of rehab, learning to walk, talk, eat, and regain cognitive functions. And now those same doctors who saw him almost die say he's now close to his former self, working, staying active, and he's even biking again.
When I think about where I am right now and how amazingly well things have moved forward, of course, I'm so thankful.
The people at Capital Bike Share told us they make every effort to encourage bike share riders to use helmets. There's messaging on bike racks and on their website, too. And they offer these discounted helmets, just $16 for a high-quality helmet for members. So why not take advantage of it?
Well,
Be
worth
safe.
the money.